Getting a new diabetes diagnosis can feel, well, pretty overwhelming. But the thing is, that journey often starts way before you ever see a prescription bottle. It starts with a simple question: could I be at risk? So let's walk through that whole path together, right from the first inkling of risk all the way to building a solid, complete care plan. So, what does this journey really look like day to day? We're going to break it all down, step by step. Think of this as a roadmap, showing how doctors go from, there might be a risk here, to a clear diagnosis, and then most importantly, how they build a totally personalized plan for managing life with diabetes. Okay, so the very first step on this journey, it's all about figuring out who should even be getting tested. It's not just random. There's a very targeted approach based on some really well-defined risk factors. Right, so think of this like a checklist your doctor uses. The main starting point is having a BMI of 25 or more, so being in the overweight category. But that's just the start. After that, you just need one more thing from this list to be true. It could be something like your mom or dad having diabetes, not being very physically active, or having another condition like high blood pressure or PCOS. Any one of those is enough to flag a need for testing. And here's something that's super important, a really key update to the guidelines. Basically, for any adult who is overweight or has obesity, screening should now start at age 35. That's a big deal. It used to be 45, so this change really shows a big push toward catching things earlier. It's all about being proactive. Okay, so let's say the risk factors are there. You and your doctor agree it's time for a test. What happens next? Well, this next stage is all about the numbers. How do we take a result from a blood test and turn that into a clear, official diagnosis? Let's get into it. One of the most powerful tools in the box for this is the A1C test. I love the way this is described here. It's not a snapshot of one moment in time. It's more like a report card for the last 3 months. It gives you the average. This gives doctors a fantastic big picture view of what's been going on, and that's exactly why it's so central to making a diagnosis. And here they are. These are the numbers that really matter. It doesn't matter if we're talking about the A1C, a fasting glucose test, or that glucose drink test. There are very clear lines in the sand. See that A1C? Get a 6.5% or higher, and that confirms a diabetes diagnosis. It's that clear. And pay attention to that middle column for prediabetes. That is the critical warning zone. It's your body's way of saying, hey, we need to make some changes. So once the diagnosis is official, the conversation pivots. It immediately goes from, what is this, to, okay, so what are we going to do about it? And that's where setting clear personal goals for treatment comes in. So the American Diabetes Association, or the ADA, lays out these standard goals. Think of them as the starting point for most adults with diabetes. The big one, the one you hear about all the time, is getting that A1C down below 7%. And the other numbers you see here, those are the targets for your day-to-day blood sugar checks, before and after you eat. And this is so incredibly important to understand, these goals are not one-size-fits-all, not at all. Just look at this comparison here. It's a perfect example. For a 25-year-old who's otherwise healthy and really engaged in their care, you might push for a much tighter goal, like an A1C of 6.5%. But now, take an 80-year-old who might be a bit frail, maybe has some heart issues. For them, the biggest danger isn't slightly high sugar, it's hypoglycemia. That's when blood sugar gets dangerously low. A low sugar episode could cause a fall, which could be catastrophic. So for them, a more relaxed goal, maybe an A1C under 8%, is actually much, much safer. It really is all about tailoring the plan to the person. Right, and a huge part of making that plan personal is picking the right tools from the medication toolkit. And wow, the toolkit we have today is amazing. It goes way beyond just lowering blood sugar. The real art and science of it is picking the perfect tool for the right person at the right time. Now, this can get super complex, so let's try to simplify it. We can basically group most of these modern drugs into 3 main buckets, just based on how they work. You've got ones that make your body more sensitive to the insulin it's already making. Then you have others that give your pancreas a little nudge to release more insulin. And finally, there are drugs that literally help your body offload or get rid of extra sugar. Okay, now for this table, I want you to really focus on that key benefit column. This is where modern diabetes care gets really interesting. Metformin, that's the classic. It's been the go-to first-line drug for ages, and it's very low cost. But then you look at the newer stuff, like semaglutide. It doesn't just help with insulin. It also has these incredible weight loss and heart and kidney benefits. Same with a drug like canagliflozin. It's a glucose offloader, and doctors often choose it specifically for its powerful heart and kidney protection. This is what I mean. The modern approach isn't just about chasing that A1C number anymore. It's about looking at the whole person. And of course, we have to talk about insulin. For a lot of people, it's an absolutely critical tool. The trick is to understand that there are really two main kinds of jobs that insulin does. First, you've got your rapid-acting insulin, sometimes called bolus insulin. This is your mealtime insulin. It kicks in super fast, like in about 5 minutes, to cover the spike in sugar you get from eating. And then you have your long-acting or basal insulin. This is your background insulin. It works slowly over a long period to give you a steady 24/7 level of control even when you're not eating. Okay, so we've got the diagnosis, we've set the goals, and we've looked at the medication toolkit. But here is maybe the most crucial point of all. Top-notch diabetes care is about so much more than just blood sugar. If you really want to prevent those long-term complications, you absolutely have to look at the big picture of a person's total health. So how do you keep track of it all? Well, a lot of clinicians use this really simple but powerful framework. It's basically the ABCs of diabetes care. We're going to walk through each letter one by one because this is what turns a good care plan into a great one. All right, let's kick it off. A is for aspirin. See, diabetes really bumps up the risk for heart attacks and strokes. So for some patients, a doctor might recommend a low-dose aspirin to help prevent that. It's always a careful balancing act, though, weighing the benefit of preventing clots against the risk of bleeding. Next up, B is for blood pressure. Here's a good way to think about it. Imagine your blood vessels are like pipes. High blood sugar makes those pipes kind of brittle, and then high blood pressure puts them under constant, relentless strain. That's why controlling blood pressure, getting it ideally below 130/80, is just so critical for protecting your heart, your kidneys, and even your eyes. All right, on to C. C is a 2-for-1, cholesterol and creatinine. Pretty much every patient is going to be on a statin medication. That's to manage cholesterol and keep those arteries clear and protected. And creatinine, that's just a simple blood test that gets checked at least once a year. It's to make sure the kidneys, which are like the body's super important filtration system, are working properly. D is another twofer, diet and dental care. Now diet, that's kind of a no-brainer, right? It's a huge cornerstone of managing diabetes. But here's the one people often forget about. Dental care. High blood sugar can create a party for bacteria in your mouth, which boosts the risk of gum disease. And here's the kicker. Gum disease can actually make your blood sugar harder to control, so it's a vicious cycle. Getting regular dental checkups is absolutely essential. Okay, E stands for exercise and eye exams. For exercise, the big goal is to hit at least 150 minutes of moderate activity every week. Think brisk walking, that kind of thing. And those annual eye exams where they dilate your pupils, totally non-negotiable. The whole reason is to catch something called diabetic retinopathy, which is damage to the tiny blood vessels in the back of your eye, long before it could ever possibly mess with your vision. Next, F is for foot examinations. Okay, this is another big one. Diabetes can damage the nerves and also reduce blood flow, especially to the feet. That means you might not feel a small cut or a blister. So getting a really thorough foot exam by a professional at least once a year is crucial to check for sensation and prevent really serious problems, like ulcers that won't heal. And finally, G. This brings us right back to where we started, goals. This just means you have to keep talking about it. Regularly discussing and reinforcing all of these targets, everything from the A1C to your blood pressure to cholesterol, to make sure that the entire comprehensive plan is working and staying on track. So, this really brings us to the final and most crucial takeaway of this whole journey. Managing diabetes isn't just about one number or one pill. It is a comprehensive team effort. So, looking back at this whole ABCDEFG framework, the big question you should be asking yourself or asking for a loved one is simple. Is your care plan covering all the letters?